So I'd go into my patient's room, check their armband, ask if they have any questions about the procedure and explain what I was going to do to them. I would also raise the head of the bed to my level and then put the head of the bed down if my patient was allowed to lay supine, so I can have a better view of the area where I'm going to be inserting the catheter. So I would come and get all my materials ready. So create my sterile field and keep a 1-inch border around everything. And I'm going to put the pad under my, and I would also wash my hands first before touching any of that. So tell my patient I was going to put a pad under them. Grab the corner here to keep this sterile. So I was placing it under them. And then put on my sterile gloves. Not contaminate my sterile field here. And starting with my non-dominant hand, so I can touch the outside here. Usually it would go smoother than this. I'll fix that once I get this one on here. Okay, and now I would put this pad over my patient to kind of give them a little more privacy. And I would set up all my materials, keeping a 1-inch border around everything. I would soak my cotton balls with the iodine, so to get them sterile, but obviously I can't do that on the mannequin. And I would have my lubricant, which we can't use the ones in our kit, so I would use this. Before I lubricate that, I'm going to put my syringe on. And then lubricate my catheter. And then I would go and wash off my patient's penis. So hold it and start with the outside and go around this way over the tip. And now I'm ready to insert my catheter. If my patient had a foreskin, I would pull that back. Tell my patient to take a deep breath.
know you want. You want to make lots of money. But considering the profession you're in, you can't. You can. Maybe not you.
And go until I meet resistance. And then once you hit resistance, you fill up the balloon. Disconnect the syringe. And then pull gently so you can make sure that your catheter is in the right spot, not going to come out. And then I would secure the catheter with tape here. Not use too much so you don't cause skin breakdown, and I would tape it either to the inside of the leg or the stomach about right here. Just kind of, you can ask your patient if they have a preference. So tape it to the inside of the thigh. And then attach the catheter or the collection bag to the side of the bed. If I needed to draw any lab specimens, I would draw them from this port. And I would wash off my patient's penis with, to get all the iodine off so I don't leave that on there. And then I would check for the color of the urine, any sediment. If I had drawn a lab specimen, I'd be able to smell any odor that the urine had also. Then I would clean up all of my materials. And once I was done, I would assess my patient, see if he was having any pain or anything. And then I would document the date and time that I put in the catheter, the size of the catheter I used, my urine analysis, so color, sediment, stuff like that, and the size of the catheter that I used, and my patient's reaction to the procedure. And that's it.